we're getting ready to go into the operating room to perform a procedure with a system called Aura, which allows us to take intraoperative measurements of the eye and give us a more accurate reading on what power lens implant is going to go inside the eye. And before this technology was available, you really didn't know how effective your surgery was until several weeks after surgery, when you could take readings at that point called a refraction to find out how accurate your lens power selection actually was. Very good. Keep looking right there. That's perfect, 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 perfect. Keep looking. Great job. So we've had this new technology which is now called Aura, originated as something called Orange, and more generically is what we call intraoperative aberrometry, which allows us to be more precise when it comes to lens power selection for cataract surgery. That power implant dictates how sharp your vision will be without glasses or contact lenses after surgery. So I want you to look at this flashing red light for me now. Capture straight in front of you, right there. Very good. Keep looking, keep looking. Great. Instead of making the measurements preoperatively and doing the calculations based on those measurements with the cataract in place, we can now do it in the operating room immediately upon removal of the cataract. The Aura system has now gone through a couple of renditions, the latest being the most effective and the best intraoperative aberrometry system, I believe, that's out there right now. It's been very effective today. We've confirmed some of our preoperative calculations and kept the lens powers the same. On the other hand, on a couple of cases, the Aura saved us. It helped show us that the lens powers that we calculated preoperatively instead needed to be changed in the operating room. Changing those lens powers is going to guarantee the patient a much better outcome than if we had gone with our calculations that we did preoperatively. So we're excited about that.
I'm a quilter, and we use little teeny tiny needles, and you have to thread them, and it was like there wasn't a magnifier big enough for me to see how to do that anymore.
My wife was concerned with my squinting and how my vision was going downhill.
And my long distance vision is what really became the issue for me.
Reading. This eye I could read from about here, this eye from about here, and everything was nearsighted.
The headlights would like spear. Instead of being a glow, they would spear, and it was real annoying.
In my business, you have to be able to read things constantly and doing stuff. So I just said something, I need some new glasses, but that's when it turned out I needed something a little bit more.
I have been amazed at the staff, and Dr. Labor just continues to amaze me. He's so understanding, and he listens when you talk to him. He doesn't dismiss your opinion, and he has brightened my life considerably.
He didn't seem to be in a hurry. I felt like I didn't have a lot of questions, but had I had them, I would have felt comfortable asking. And a lot of doctors will come in and you could tell they just want to get out and get on to the next one. He didn't appear that way at all.
And you know, they make you feel at ease here. They do everything in their possible, that they possibly can here to make you feel at ease.
The people back in the operating room, they're great. I tell you, they just make you feel like you just been there, knew them all your life.
In this facility, they are all so caring and concerned, and just, there are many people who come here, but you never feel like you're one of many. You're one.
Really enjoyed the experience with people. The people here were terrific. They were all just fantastic. And Dr. Labor did his magic.
You know, during the surgery, I didn't see him that much, but I know I knew he was there before I kind of got sedated. And then I think that he gave me a phone call even the next day or that evening to check up on me.
Friday night, phone rang. It was Dr. Labor checking to see how I was doing. And I was couldn't believe it.
The doctor actually called me? I said, give me a break. You know, how often does that happen? I mean, I've had other surgeries done in the past, and, you know, you're just a number, you know, sweep it underneath the rug. Okay, next. But with the sincereness from Dr. Labor, I felt, you know, a lot more at ease that night.
Dr. Labor is very personable, but he's also very knowledgeable, but he breaks it down he explains to you the science of it, but then tells you the options of, if you do this, this is the result. If you don't, then this is what you can expect. And he always leaves it in your hands.
I sing in our church choir, and to be able to look at my music and look up at the director and go back to what I used to do when I was in high school, with this whole procedure, and seeing all levels, that's another just amazing thing to me.
You know, I have a different outlook, and I'll look around and I'll even talk with my customers even about it and say, well, Albert, are you 20/20 yet? And I says, no, but see that fly crawling on the wall over there?
Distance-wise, I can see really, really well. And it's just nice to be able to, you know, in fact, you know, if I wore glasses, I'd be fighting them because, you know, you don't see as well out of the glasses.
Just the idea of the freedom of not having to be dependent on glasses and keeping up with scratches.
It's been a real blessing for me to have it restored, because we adapt as we get older, that we just forget how things were and live with the now. And so I get to start all over. I like that part.
I'm so glad I came here, because I got exactly the results I hoped for, but had no idea that for sure it would be that good. And it is.
They're real good people in my book. They're very straightforward and honest with you, and that means a lot to me.
I trusted Dr. Labor, because if you're going to let somebody near your eye, you better believe in them, and I do.
The first thing that, you know, he said when he walked in the door said, how can I help you?
There's a member from my church that he was going through the same thing, and just by coincidence, Dr. Labor was there, was going to be his. And so after I talked with him at church, he was more comfortable with it. And then when we met up about a week later after he had his first procedure done, he says, Albert, he says, you were right. He said, they're awesome out there.
I've had glasses since I was 5, so I would rather go without glasses and contacts and make everything much easier. I mean, it's going to go okay. There's no doubt in my mind that Dr. Labor is going to do an awesome job, no doubt.
One of the things that surprised me the most was how quick, how very efficient the entire procedure was. It was almost as if it had been choreographed. If you were watching a ballet or an orchestra, everything was choreographed.
I've just grown up with glasses, and past probably 3 years I've had contacts, and my vision was never really good with contacts.
I first got glasses when I was in 7th grade.
I couldn't do anything. I couldn't even wake up in the middle of the night and see what time it was on my alarm clock.
I even remember not getting my glasses and it not bothering me that much, but as I got older, those things changed.
Basically, I got tired of wearing contacts all the time.
I was tired of having to lean forward and look at the big 3-inch high red letters on the alarm clock next to my bed.
It was just getting too much, so I just wanted to stop using those contacts.
As a former military member, I'm used to the precision and the efficiency. It sort of reminded me of being in the military and having things done go very smoothly.
Dr. Labor's voice is very calming, and he's funny, and he really put me at ease.
Ready to get fixed. All that astigmatism goes away.
I'm glad, finally. So it was It was, I definitely got worked up for nothing.
Within 2 days, I was seeing fantastic.
I'm a 2015, which is better than perfect.
As a matter of fact, I was able to make about 150, 200-mile trip driving 4 days after my surgery with no ill effects.
I went home and slept for like 4 hours, and when I woke up, it sounds corny, but I cried because I could see.
It was liberating, the entire experience. If you've never had poor vision and all of a sudden can see, and literally almost all of a sudden you could see. You can see leaves, you can see trees, the leaves on the trees, the grass. You can see across the parking lot. I did not need the glasses or contacts for the first time in 39 years.
I'm looking forward to that. Pretty cool not to have glasses and drive and go places and do things and not have to think about having my glasses on or contacts on. Or
if you had a chance to do it over, would you have gotten LASIK and Eye Consultants of Texas again?
Absolutely. Wouldn't trade it for the world. I was thinking about that the other day, how different my life has been since I've had LASIK.
I want to tell you about my crystallines experience at Eye Consultants of Texas. I'm a physician, and the area of medicine that I practice demands that I have really perfect vision. Not only perfect vision, but I have to have and be able to evaluate and differentiate between different contrasts of shades of gray and color as well. So when I was deciding to have intraocular implants placed because my vision had deteriorated so badly, when I chose crystallines, one of the reasons why I chose it was because of the contrast enhancement that the lens gives. When I decided to go ahead and have my surgery, I chose my husband, Dr. Kirk Labor, to do my surgery. I chose him because he implants more crystallines than many other ophthalmologists in the country. Now I know what you're thinking. You're thinking, yeah, you had a really good experience because your husband did your surgery. But I had a wonderful experience at Eye Consultants of Texas because that's how every patient is taken care of. On the day of my surgeries, when I had to come in early to fill out my paperwork, to sign my consents, I was sitting in the lobby with all of the other patients and wasn't treated any differently. Now let me tell you what I saw. Absolutely amazing. After the first surgery, I could close my right eye and keep my left eye open. I had my left eye surgery done first. And everything was crystal clear, absolutely perfect. I could see detail in the leaves of the trees. I could see the bark on the tree. It was amazing. In fact, when I opened my eye after surgery and the second crystallines had been implanted, it was astounding. I just could not believe how good my vision was immediately post-operative. It was absolutely amazing, and it was just, I realized then I'd just done the most incredible thing for myself, not only for my work, but also for my everyday, my day-to-day living. It has been the most fascinating thing to watch as my vision has improved over every week after my surgeries. One of the most incredible things that I can't really even describe, but I will try to describe for you, is the colors that you see. See, the crystallines, with the crystallines, you can see more wavelengths of light than you can actually see with your natural lens. I hope that if you decide to have crystallines, that you will realize that it is absolutely the most amazing thing that you will ever do for yourself.